When your health data is exposed, the repercussions can be vast. We're all in this together, and the fight against healthcare cyber threats is ongoing. The financial repercussions of these can be astronomical too. We predict these repercussions to reach $60 billion. With over 100 million people's accounts compromised this last year, it's vital that we learn how to protect ourselves. Hello everyone, welcome back to the VPN Ranks YouTube channel. In today's episode, we're going to be discussing something that hits close to home for all of us: cybersecurity in the healthcare sector. With over 100 million people's accounts compromised this last year, it's vital that we learn how to protect ourselves. Stick around as we delve into how these breaches occur, real-world cases of people like you and me, and what can be done to protect our most sensitive information. Let's start with the startling fact. Cyber attacks in healthcare are not just frequent, they're also becoming more severe. Last year alone, the number of compromised health records jumped massively. Cybercriminals are becoming bolder and smarter, finding new ways to breach defenses. Looking ahead, the forecast is even more alarming. Projections suggest that by 2026, nearly 1 billion people could be affected by healthcare data breaches. Every day, we could see up to a little more than 419,000 records compromised. And with ransomware attacks predicted to rise dramatically, the urgency for action has never been clearer. When your health data is exposed, the repercussions can be vast. Identity theft, fraudulent medical claims, and the emotional distress are just the beginning. The financial repercussions of these can be astronomical too. By 2025, we predict these repercussions to reach $60 billion. Each of these exploitation methods not only undermine the trust in the healthcare system, but also compromise our privacy and security. It's crucial that patients understand these risks and take actions to protect ourselves against them. First, there's identity theft and fraud. In 2023, 14% of breach victims suffered from identity theft incidents, largely because healthcare data often includes comprehensive personal details like names, social security numbers, and addresses. Medical fraud is another severe consequence, where stolen information is used to file false insurance claims or obtain medical services. This type of fraud has cost the healthcare industry a staggering $40 billion in 2023 alone, which is a clear indicator of the financial drain these breaches cause. Prescription fraud also poses a substantial risk. Approximately 12% of healthcare data breaches last year resulted in fraudulent prescription activities, exacerbating the opioid crisis and other related health emergencies. Then there's blackmail and extortion. About 30% of ransomware attacks on healthcare institutions involve threats to release sensitive medical information unless a hefty ransom is paid, sometimes as much as $1.5 million. Resale on the dark web is yet another peril. A complete medical record can sell for between $50 to $1,000, making it a valuable target for criminals. Last year, over 15 million patient records were discovered for sale on the dark web. Lastly, we must consider the threat of phishing and social engineering. Data from healthcare breaches is often used to craft highly convincing phishing attacks. In 2023, 81% of organizations affected by breaches reported subsequent phishing attempts, leading to further data loss and financial damage. Each of these exploitation methods not only undermines the trust in our healthcare systems, but also poses real threats to patient safety and privacy. It's crucial that we understand these risks to better protect against them. In 2020, a ransomware known as Ryuk, deployed by Russian hacking group Grimspider, was responsible for a third of all ransomware attacks on healthcare institutions. This particularly malicious software emerged in 2018 and is notorious for its rapid and destructive spread through healthcare networks. Ryuk's method of attack is chillingly effective. It often enters through a Trojan called TrickBot, initially targeting financial institutions to siphon often personal and financial data. Once inside a healthcare system, Ryuk uses vulnerabilities like the SMB protocol to propagate itself across the entire network, seizing control of everything from VoIP phones to critical medical devices like EKGs and MRI machines. The impact on healthcare services is catastrophic. For instance, at Düsseldorf University Hospital, a Ryuk attack disrupted systems so severely that a patient requiring urgent care had to be redirected to another facility, tragically resulting in her death. United Health Services, which was another victim, faced system outages across its facilities, leading to significant operational disruptions and financial losses. By the end of 2020, Ryuk had extorted around $150 million in ransom from US hospitals alone, and this was paid in Bitcoin. This underscores the importance of robust cybersecurity measures in the healthcare system. Combating threats like Ryuk requires robust cybersecurity measures. Healthcare institutions are enhancing their digital defenses, implementing strict access controls, and investing heavily in staff training on cybersecurity protocols. And while healthcare providers are stepping up, you can also take steps to protect your personal information. We recommend that you be vigilant about where you share your health details, always monitor your records, and be aware of phishing scams that are currently targeting patients. We're all in this together, and the fight against healthcare cyber threats is ongoing. By staying informed and proactive, we can safeguard our most private information. Now go ahead and hit the like button if you learned something new today, subscribe for more insights, and share this video to spread awareness. Thank you for joining us. Remember, your health data is worth protecting. With that said, stay safe, stay secure, and we'll see you in the next video.